Hi, I'm Ingebjørg Jørgens, and I'm a specialist in physical and rehabilitation medicine. I work at Sunnaas Rehabilitation Hospital in Norway, and I'm also a PhD student at the University of Oslo. I will now give you a lecture about a model of sustainability in healthcare in Norway. And in this lecture, I will tell you about some geographical and climate challenges in Norway. I will also give you a short overview of the welfare and healthcare system in Norway. Then I will focus on Sunnaas Rehabilitation Hospital and the work we have done at the hospital to sustain our abilities regarding climate and environment. Norway seems to be a small country, but the country is long. Actually, you will reach Rome in Italy if you turn the country upside down. And the country has the second largest coastline in the world. Only Canada has a longer coastline. We are not so many inhabitants in the country, 5.5 million people, but at least 2 million of those live in and close to the capital on the eastern part of the country. The rest live in smaller cities and scattered all over the country. Because of the fish industry, farming, and of course the oil, we are a wealthy country and we have a good working infrastructure. But the geography sometimes makes it difficult to live here and to travel around, or to be able to participate in society. The distances may be long, with driving distances of 3 to 6 hours to get to the hospital. Low temperatures makes it dangerous to be outside of the house during winter time. In some areas, the temperature as low as 50 degrees below zero may be the common during the coldest part of the winter. And temperatures as low as 20 degrees below are quite common for many parts of the country. There are windy weather, storms and hurricanes at the west coast, blizzards and avalanches in the mountain areas. Snow in the road makes it difficult to drive, even though we have good winter tires in Norway. Rock slides and floating also makes it difficult to travel, and smaller communities may be isolated for days and weeks because of this. This makes caretaking and traveling very difficult. In Norway, we have a welfare system based on tax contribution from all inhabitants being in a paid job. Also, companies have to pay taxes. We have a social democratic system where those who can and are able take care also of those who can't and are disabled and in a condition of not being able to support themselves or their families financially. This system works fine. And there is also a system to uncover any abuse of the benefits. Our tax money, together with returns from governmental investments of the oil money and other investments, pays for our infrastructure. Schools, college and university education is free. Fire and police services are free. We get a retirement pension when we are 67, and social welfare and healthcare are almost free. The health care services covers all Norwegian inhabitants and also citizens of the European Union who has legal residence and permission to work in Norway. Sickness benefits covers almost all health issues. Assistive aids used in everyday life is covered. Adjustments of home, workplace, school, or adjustment of cars, personal assistance, and disability benefits. Now I will try to explain the organization of the healthcare system, and this might be a bit difficult. But overall, the healthcare system is organized in a regional specialized service, which is the hospitals and the institutions. And then we have a primary municipality service, which is the GPs, local home care nurses, nursing homes, municipality OTs, PTs, speech therapists, etc. But because of a somewhat different legislation between these two systems, communication and information sharing is difficult, which in turn makes collaboration a bit difficult. Okay, now you have got an overview of Norway and the healthcare system in Norway, and also some of the problems regarding both climate and organizing of the healthcare system. Now I will tell you about the hospital where I am working and what we have done for the last 6 to 8 years to sustain our abilities. Sunnaas Rehabilitation Hospital is one of the largest rehabilitation hospitals in the northern of Europe. We don't have any acute care function, just rehabilitation. The hospital has about 160 beds and 8 different wards, where 5 of them are focusing on post-acute rehabilitation or early intervention. And 3 wards focusing on long-term follow-up for defined patient groups, and also short-time evaluation for persons with severe pain syndromes, loss of function, cerebral palsy, post-polio syndrome, etc. The long-term follow-up is for patients where the hospital has lifelong follow-up responsibility, like spinal cord injury and locked-in syndrome, as well as some rare congenital disorders. There are almost 800 employees working at the hospital, most of them in the clinical wards. Due to the Norwegian governmental provisions, a larger content of the rehabilitation services are now performed in the outpatient clinic and in the municipality. And many of the outpatient consultations are performed via video conference to the patient's home or to the municipality. The hospital is defined as a green hospital. This means the hospital has an adopted environmental policy plan in the strategic documents, with an overall goal to reduce greenhouse gas emission. We have hired an environmental manager to focus on environmental sustainability in all departments and wards at the hospital. All employees are included and involved in this work. We have a responsibility to protect and to maintain our environment and contribute to reduce pollution in any way. This is achieved through encouraging of the environmental strategy in the management as well as among all employees in strategic action plans and measurements. To be more specific, this is embedded in a green office policy. where we are encouraged to focus on the importance of sustainability regarding reduction in use of energy, or more specific, in use of electricity, avoidance of waste like paper waste, avoidance of transportation leaving greenhouse gases into the environment. So we are encouraged to walk, bike, use public transportation, and we also have free charging of electric cars at the hospital. And we are encouraged to think environmental in all purposes. And here you can see the amount of greenhouse gas emission for the hospital in 2018. What we see is that the use of electricity was an issue. Norway is a cold country with, as mentioned earlier, low winter temperatures, making it necessary to heat the houses, including the hospitals. Also, traveling was a negative factor at our hospital. But look at the positive factor of telemedicine, or more accurate, telerehabilitation. I will now give you an overview of the greenhouse gas emission divided into different parts of the hospital operations, and then tell you about what and how we manage to turn the environmental impact into a more sustainable direction. As you can see in this pie model, the biggest emission was from food, electricity, consumables and services, depreciation and construction, purchases and transportation. And I will also focus on the positive effect of telerehabilitation in the further. When we use telerehabilitation for those who this is a sustainable solution, we will also have a reduction of transportation to and from the hospital, because a larger proportion of the outpatient service can be offered direct to the patient at home. This at-home service is safe and secure, with a specialized healthcare professionals offering guidance and treatment via video conference or via other remote e-health solutions like webinars or e-learning courses. It is possible to combine this service with collaboration with the primary healthcare providers. And the specialized healthcare professionals have the possibility to offer education, guidance, and cooperation directly to the local care providers and in cooperation with the patient. This is really a win-win-win situation. And at our hospital, an increased remote service has given a considerable reduction in the need for transportation, resulting in a reduction in the greenhouse gas emission. Based on the environmental savings by using telerehabilitation, our environmental manager, together with the managers from other hospitals in our region, have made a model draft to how we can map these savings. The model is a bit difficult to understand, at least at first glance, but the variables used in the calculation are based on the amount of consultations, whether the consultation have been remote using telerehabilitation or on site at a hospital. Here it is important to account for whether the service is at a regional or national level, because this will impact the traveling length and amount. Also, it is important to account for what sort of transportation is being used: private, public, car, boat, flight, train. And of course, the travel activity among the local care providers, including their length of travel to and from their care receivers. And also what kind of equipment is needed when using telerehabilitation. Will this equipment lead to increased use of power? If the use of telerehabilitation significantly increased, then there should also be a focus on if this will result in increase or decrease of food consumption, use of single-use equipment, area requirements, other services, etc. Because if more of the follow-up takes place at home, then there will be a reduction in the food consumption at the hospital. There will be less wear and tear on the buildings, a reduction in the purchase of medication and equipment. Also, the use of electricity and power might decrease. But the overall environmental savings at the hospital, but if the overall environmental savings at the hospital increases, it is important to remember that the reduction in unfavorable environmental use at the hospital probably will have a rebound effect at another location, like in the municipality. However, when using telerehabilitation, there will be a reduced transportation cost compared to on-site consultations. When I did a feasibility study of telerehabilitation, I also did a cost-benefit analysis, and I found that the transportation cost savings at our hospital were rather huge. You can see that on the small figures here. Outpatient consultation via video conference constituted approximately 15% of the cost of on-site consultations at the hospital. And when we compared video conference with hospitalization, we found that the video conference constituted approximately 3% of the cost of hospitalization. Environmental savings will almost always reduce the environmental impact, and the environmental efficiency will be the usefulness divided by the environmental impact. So the lower the impact, the higher the efficiency. So when we focused on the environmental impact at our hospital and reduced the waste following the Green Office policy regarding simple actions of everyday life, including increasing the use of telerehabilitation services, and also reducing the electricity waste regarding heating, etc., we managed to reduce the greenhouse gas emission by 50% in 6 years. And that is really something we are proud of. Most of this reduction was because we started focusing on how we could protect the environment and what we could do. And this is also my take-home message to you. Every little step counts. You can make a change. So please do something. Thank you for your attention.